Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I talked about how to look beyond intensive care and create new pathways. You can check out last week's blog by clicking on the link below this video. In today's blog, I want to answer a question that we get quite frequently. And the question is, do patients in intensive care have the right to be treated at home? Let's dive right into it. A huge part of the work we are doing at Intensive Care at Home is advocacy for our clients, more specifically clinical advocacy for our clients. Our core service delivery is to provide 24 hours a day ICU and pediatric ICU nurses at home for mainly long-term ventilated patients, adults and children with tracheostomies, and for otherwise medically complex long-term ICU patients, again, adults and children. From that perspective, we often advocate on our clients' behalf when they first contact us and inquire about our service when they have a family member stuck in intensive care or pediatric intensive care on a long-term basis. We advocate on our clients' behalf to health funding authorities, to hospitals, to ICUs, pediatric ICUs, etc. Funding streams to continue care and treatment at home for long-term ventilated and otherwise medically complex patients, again, they are adults and children in intensive care, are there, but they are often hidden, and we know how to access them because we know how to advocate for them. Going back in time, in the late 1990s and in the early 2000s, Germany was the first country to embrace the concept of intensive care at home for long-term ventilated patients, again, adults and children with tracheostomies and for otherwise medically complex long-term ICU patients. Intensive care at home in Germany was a natural evolution from immensely successful hospital in the home concepts developed in the 1970s and 1980s, and the next natural progression was to develop services that could take care of long-term ICU and pediatric ICU patients on life support, mainly with ventilation and tracheostomy. Therefore, the right for patients to have treatment at home instead of in a hospital or in ICU or pediatric ICU, whenever possible and clinically safe, was legislated and became a right for patients and their families. In Australia and in other English-speaking countries, we are not quite there yet and are lacking behind in that patients and families have the right to quote-unquote demand intensive care at home services whenever it's clinically appropriate and safe. However, our growing client base and our increased number of inquiries are telling us that the demand in this area is ever growing and that more and more long-term ICU and pediatric ICU patients and their families in intensive care are looking for the better intensive home care alternative that provides a win-win situation for all stakeholders by improving their quality of life, or in some instances, quality of end of life for patients and their families at home, and to continue ventilation and tracheostomy weaning at home, have mechanical ventilation and tracheostomy for the rest of their lives if it aligns with the patient's wishes and advanced care plan. Furthermore, we cut the cost of a 5,000 to 6,000 per bed day ICU and pediatric ICU bed by approximately 50%. We free up in-demand ICU and pediatric ICU beds that can be used for other more critically ill patients. We reduce the wait times for patients in emergency departments or in the emergency room in need of ICU and pediatric ICU beds. We cut surgical and medical waiting lists for patients needing ICU and pediatric ICU beds. In fact, intensive care at home is a no-brainer because it helps all stakeholders to create a win-win situation and achieve their goals. It also helps patients and families to continue intensive care specific treatment, such as mechanical ventilation or tracheostomy at home that requires the skills and expertise of ICU and pediatric ICU nurses. This skill level and expertise that we bring into our clients' home 24 hours a day, 7 days a week, around the clock, and 365 days a year improves the quality of life for patients and their families, and it frees up in-demand ICU and pediatric ICU beds that cost $5,000 to $6,000 per bed day, and by us providing intensive care substitution services in the home, we cut that cost by over 50%. Because intensive care at home creates a win-win situation for all stakeholders, it should be a right. So if you want to find out how we can help you to get your loved one out of intensive care, including palliative care, also out of long-term acute care, or if you find that you have insufficient support for your loved one at home on a ventilator or with a tracheostomy, if you want to know how to get funding for our service, or if you have any questions, please contact us on one of the numbers on the top of the website, or just email me to patrick@intensivecareathome.com. That's Patrick, Patrik, @intensivecareathome.com. Also, if you are an intensive care nurse, please check out our career section. We are currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area, in the northern suburbs, Mornington Peninsula, and in South Gippsland, Victoria. We are an NDIS, TAC, and DVA approved community service provider. Also, have a look at our range of full service provisions on our service section. We have also been part of the Royal Melbourne Health Accelerator program in the past for innovative healthcare companies. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.